I'm here.
Yay. Okay.
So I thought my headphones were supposed to connect, but it disconnected as soon as I did the live.
Oh,
I don't know.
that's okay. Okay. So. Oh no. I don't. Anyway. Do you want to start? I don't know. I guess it's. Wait. Is your audio okay? Sorry, technical difficulties to everyone that's watching us.
Okay. Yes. Okay.
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 Good?
I can hear now.
Okay.
Yeah.
Okay. Hello world. Instagram Live. This is so odd. If you watch everyone else do this and it seems so normal, but I guess it's actually way more bizarre than I thought.
I know, this is kind of crazy. Okay, let's start with intros. You want to go first?
Thanks for suggesting that. Well, I'm Diana, and I guess this is just, we're starting this thing called Global Caveat. It's mostly to help explain what global health is and to just, well, really help with health communications. So I am in New York, and I am a graduate student studying global health and epidemiology. And through this wonderful platform of Instagram, I found Susanna. So you can say who you are, Susanna.
Okay. All right. Hi, everyone. Thanks for joining. My name's Susanna. I don't have nearly as many talents as Diana. But I'm also studying global health. I'm in my second year for my PhD. So yeah, I'm excited for this because Diana is also in global health, and I feel like we're kind of the oddballs in this, I don't know, science/social science world, right?
Yeah, hang on, keep talking.
Yeah.
I'm gonna put a little intro thing here and see if I
Okay,
can.
perfect. Yeah. So to everyone that just joined, if you also want to introduce yourself down below on a comment, please go ahead so that we can see who's joining us. If you're from Diana's community, hello, I'm Susanna. And if you're from Diana's community, I mean my community, that's Diana. How's the pinning going?
Typing is really difficult when you have your phone on a tripod.
Yeah, so if people could, if you're watching, please introduce yourself. We would love to get to know you. And then if you have any questions along the way, feel free to type them in. Nice. Hi, Marisa. Talk to her. Thank you, thank you. So nice. You know, I'm actually very surprised by the response that we got with this live session. Oh, Natasha joined, I see.
How do I get rid of this? How do I make it go down? Okay.
Oh, perfect.
Woo! Okay, I figured it out.
Yay. Thank you, thank you. Yeah, so if you're just joining, we did our intros and it's pinned down there, but if you would like to introduce yourself, please do so because we would love to see who's joining us for this live session.
Yeah, and you are also, because the whole point is to be globally engaged. So
yeah.
Although like late in other places or really early. I know I kept putting the Greenwich time and Australian time. So
I'm in Oregon in the United States, and then you're in
New York.
Yes. So we're on complete opposite sides of the map. But we're talking. Okay, so I don't know, do you want to just like start talking about some misconceptions that people may have about what we do and what global health is about?
Yeah. I think maybe, do you want to just give, since you teach global health, a nice little introduction or definition?
Sure. So I always tell my students when I teach that what they think they know about global health is probably wrong, or that it's definitely skewed. I think a lot of people go into it thinking that they can change the world or that they can create, oh, hi Naomi, they can create some like this awesome good, which can be true, but I think it's people have too much of a rose-colored glasses on when they think about global health. And I think it can really color how you approach people and communities. So, but before we go there, I mean, yeah, global health to me is just like it's very interdisciplinary, lots of different disciplines coming in, attacking health issues, but from multiple angles. We're not just looking at like the diagnosis, it's not a clinical thing. It's you're looking at the social factors, you're looking at how they grew up, you're looking at psychology, anthropology, even medicine, like they're all very integrated. So Diana does epidemiology, which is a little different from what I do.
Yeah.
Yeah.
So epidemiology is essentially the mathematics behind medicine. And it actually started mostly with physicians, and originally only medical doctors were epidemiologists before it branched off and became its own separate thing. And some countries and some institutes actually still only have it. So MDs are epidemiologists. Um, I don't have any interesting way of presenting the information. Like Susanna just says, hello, you're wrong to her class. Basically, a lot of people know epidemiology for infectious disease study, the common thing, and also frequently because of Game of Thrones, Jon Snow, but not that Jon Snow. It came mostly from a cholera outbreak in London. That's like where the practice was discovered.
Yeah, and cholera pretty much makes you diarrhea. It looks like rice,
Yeah.
watery rice.
As
Yeah.
I don't know if you all know, but Susanna really loves to talk about poop.
Yeah, I do. It's a big global health problem.
Yeah.
So,
Um, yeah. So there's that.
yeah, epidemiology is very methodical in very many ways.
Yeah.
Um,
I actually have Stata, which is a like analytical software on my laptop right now because that's what I was doing right before this.
yeah. So I think when people think public health, I mean, most often think epidemiology. I mean, that's the language that's used to talk about a lot of health issues in our
Yeah.
field. Um, So what I'm doing is a little different from that because I'm in this field called global health, which is actually relatively new. Um, like a lot of people that teach it, they didn't study global health. They were medical doctors or they were anthropologists, and they just decided to join in this discourse of, okay, this approach isn't working. We need to have a global perspective. So then there's students like me who are learning from professors or scholars who didn't necessarily major in this field. They're just contributors to this field.
Yeah, it's a lot of
So,
everybody's trying to figure it out because it's like the world's health problems are constantly changing, and especially with
mhm.
how everything's going right now and the newest news of the world ending soon. Like we're trying to, as quickly as possible, figure out how to address all of these issues
Yeah.
in
So
like
it's
all of
really
the sectors. Yeah.
yeah, it's super interesting. So I mean, it's very flexible if you're a global health scholar and what direction you can take it. So for me, I'm studying it in a more policy context. So there is actually a lot of math, but a lot of qualitative aspects that go into that, which for me in my training, I'm trying to do both. I'm trying to get a lot of those numbers, the statistics in. Stata is like my enemy, but it's also something so necessary, but also qualitative research, which some people would very vigorously disagree is a science. Yeah. So, but we're not gonna go there
That's
today.
for another time.
Yeah.
Yeah.
But the qualitative aspect brings in those very human factors of how people experience healthcare, how people experience life and how that affects why they have, more diseases or, how they think and their behavior. So that's pretty much like a brief, very brief smidge of what we're in for global
If
health.
you'd like to know more besides our podcast, you can go take Susanna's class. She teaches a whole course on the introduction of global health.
Yeah. I don't
Don't
know if I'm
sit to her class.
Yeah. If you want to take my class, you're more than welcome to come. I don't know if I'm a good
Also, side
instructor.
note, we are not sponsored by Stata. There are other softwares out there. We just both use it. So
Yeah.
just felt like throwing that
Yeah.
out
Yes. I would love to be sponsored by them though.
there.
That'd be
Right?
great.
Software is very expensive.
So yeah, so now that we've talked a little bit about what we do and like at least some perspectives, back to the misconceptions. I mean, oh gosh, there's so
Um,
many misconceptions about
yeah.
global health.
I can start with a quick one that's way less intense. If I get asked about if I know how to treat your acne because you think epidemiology is dermatology, like I get asked that so many times. It is not dermatology. Um, Epi does not come from epidermis, it comes from epidemic. So that's a major misconception in my specific world of public health. Um,
Yeah, that's a really like great example. I mean,
yeah.
oh, and it looks like Natasha says she
Oh,
might have an example too. So if you want to jump in
yeah.
and just tell us what misconceptions or what you think global health is, we can maybe dispel that for you.
Also, sorry, Naomi, for Susanna ruining kanji for you.
Uh,
Oh gosh. Okay.
so yeah, so for me in my field, a lot of people think global health is going abroad and volunteering at an orphanage or for some organization, and then they come back and they're like, yeah, that was awesome. We helped some kids. Um, and I think there are really great programs out there that are medically focused that provide overseas dental care, for example, basic surgical care. Um, but even then, I think you have to think about, okay, how sustainable is this? And each organization is built differently. And with global health, I absolutely hate it when organizations tell people that they're a community organization, a global health organization, and they go in, but they're very paternalistic. They just dump, like school supplies maybe out of school, and then they leave, and it's like just waves of Westerners going in and out. And it's very unsustainable, and it's actually not a good solution because it ends up harming the community. Um, so that's what people think when they think global health. And a lot of my students come into my class thinking, oh, yeah, it's just like volunteering with organizations and making a difference. But like the first class, I'm like, no,
And
it's really not.
just for an idea to explain a little bit more about what sustainability is, like it's great to give supplies and everything, but you can't really give supplies if you're not also educating potential teachers. So in order to actually have things be more sustainable, you have to have a way, like if you're going in, you need to have a training method of actually having locals just like be able to upkeep the educational system that you're trying to implement. So if you're trying to build a school, you have to have local people actually being able to be the teachers and actually be able to get to the school and then actually being able to have supplies in the school, have students
Yes.
come to the school. So you have to like build roads and then also have food there and clean water. And there's just like so many other things. You can't just give them a bunch of pens and be like, here's pens and papers. That solves your problem, right? So
Yes.
like that's why it's like you see a lot of these things where you're sending out all these things and it's not necessarily bad, but you want to make sure you're giving that kind of like donation to a charity, not well, charity is a fine word, but an organization that is actually doing all of that work from like
Mhm.
ground zero to all the way of full implementation and then beyond implementation to actually have the sustainable running program there afterwards you leave. So
Mhm. Yeah, so Natasha asked, what are the best solutions for people who want to go abroad and help? That's a great question. This is what I tell people when they ask me this. I say, number one, if you see an organization that catches your eye or that interests you, go on their website. Like, see what they do. see if they have annual reports. I think organizations should have some kind of, like proof of what they do, right? And they should also have, if they can, expenditure reports. I think that's really important. Like, where is their money going? How is it being used? And look at the language that they're using. And also, like, how they're presenting their work is very important. So, a very real example is, I think about 2 or 3 weeks ago, there was a flyer on my campus going around where this organization was calling for volunteers, like reaching out, to college students who wanted to use their summer, and they did a lot. They said save coral reefs, which people actually get PhDs in and work like their life for. But yeah, if you want to go over the summer, you can save coral reefs. You can do elephant conservation. You can also scuba dive. You can also do a safari, and you can also do community health work. And I was like, whoa, that's a lot for one organization to do. And I went on all their social platforms and I went on their website, and it was just littered with people holding like African village babies. And I'm like, one, I don't know if you even got permission to do that. But it's very like this paternalistic look of, look at me, like I'm really awesome, I'm gonna go and volunteer. And I used this example in my class. I took this flyer to class with me and I was like, throw this away if you see this. If you're gonna spend $1,000, $2,000 over the summer to do this kind of work where like there's no, like literally I have no idea what this organization does. And it's just so poorly constructed. I'm like, if you're gonna put $2,000 towards going to something like that, spend that $2,000 actually going to like Thailand, being a tourist, because that money goes back into the economy,
Mm-hmm.
and then like visiting animal like a elephant sanctuary if that's what you care about, because that money goes back into those efforts. Like you don't have to spend that much money to do all those things because it just doesn't make sense. So I would say very practically that those are just some things you can do. Look for those reports and then reach out to the organization and be like, are there people on the ground doing this work? Why? And you can even ask like, like I have no credentials essentially. Why is it necessary for me to go?
Mm-hmm.
Like what kind of manpower do you need necessarily? Because I don't think it's necessarily bad if people go overseas to like support, but I think the majority of where the support is given should be by the local people and directed by the local community.
Yeah. And another thing that you can just think about is where would you also be volunteering if you were just at home? And you can look into something similar like that. Like I happened to be in Zurich and I reached out to a bunch of recreational centers. And then I just worked in a bunch of different recreational centers with some social workers. And I mainly contacted them because I wanted to see what their systems were set up like so I could see if I could implement it elsewhere. So I like very practically went in because that's something I would do normally at home is like volunteer in a recreational center. So it wasn't anything like I was like, oh, can I come see this? I'm not like trying to make a spectacle of anything. It's a very different thing where I'm not like I was already going to be there for something else. So you can do things like that. I mean also language barriers potentially. So there's that.
Yeah.
But otherwise it's like not necessary for you to go someplace specifically to do that work because like as Susanna said, if you're not really credentialed to do something there, then what is your role there? And also a lot of those programs, they cost so much money and it doesn't actually cost that much to go places. So you should see where their funds are going to and if
Yeah,
someone is just sitting on those or if it's actually being donated back into the community.
exactly.
Yeah.
And Danny back, you said a while back that
There was a web.
don't go don't go to orphanages, and I think I agree with that too because so it's not, there are countless studies out there where they study abandonment issues among like South African orphan children who live in orphanages, and it's pretty terrible the mental impact in the long term because if you're having this constant wave of Westerners go in and volunteer, they create it creates attachment issues with the children. And so if you have had the privilege of going overseas and visited an orphanage or any kind of community, and you have these little brown kids running after you and being very, very affectionate with you with no sense of like stranger danger going on, it's not because Africa is such a beautiful and like welcoming community. It's just, no, like they've probably been exposed to Western faces for so much that they've created this behavioral pattern of being very engaged and attached to you. And then these people leave, and then they're left with feelings of abandonment. And then another wave of Westerners come in and they become attached again. So it's actually really harmful. And I mean, I am at fault for this too because I have gone on trips in the past. So, do you ever talk to people that already participate in these programs? Yes.
Yeah. Um, I think a lot of people that are in global health, like just, I mean, how do they respond to criticism? That doesn't go so well. But in general, I think a lot of people, at least in the current like graduate school and higher, a lot of us have unfortunately participated in these types of programs. And like I know that I definitely have when I was younger and I just didn't know. And I don't think that it exists anymore. Like what I helped do or like where I worked, it was like with some church or something. And like as time has progressed, some of them modify their behaviors, like the programs and organizations, if you just call it out and you like mention it to them. Some of them just ignore you. Some people get really angry and like defensive, and like at least on Instagram they like delete you and then block you if you have ever interacted with Kiona at How Not to Dress Like a Basic Bitch. You would see all sorts of things that go on when you call people out on their shit.
Yeah.
So
Yeah, people don't like to hear that what they did out of what they thought was good intentions, which
yeah,
actually a lot of times it is with good
yeah,
intentions. But people don't like it when you call them out on it and you're like, actually, like you actually probably ended up ruining the community or the individual
yeah,
more so than you thought.
yeah,
And I mean, I wouldn't like to hear that either,
no,
but I think part of if you claim to be someone who wants to become more like humble with culture and want to become better at contributing to global health even, um, then you gotta, those are hard things to hear, but I think it's very important to hear.
yeah.
And I feel like not enough people are saying it.
Yeah, and
Um,
then I think a lot of people are open to learning as well. Like some people you just literally don't know. Like you don't know any better. You don't realize that it's not actually helping or anything. But as soon as some people learn, they're like, "Thank you for letting me know," and then they do the work to find the correct place. And Danny, do not be sorry for spamming all of this information. Please share everything.
yeah, I mean, Danny's bringing up really great points, and I'm glad that you're joining in this discussion. Creating a business model based on supply and demand that doesn't really help these kids, just gives institution incentives to take in more kids. Absolutely. Absolutely. I mean, there are even organizations over, not saying that like Westerners are always the bad ones. I mean, there are messed up organizations overseas too, and what they do is because they have so many Westerners coming in and pouring in money because they're getting something good out of it right, while they're doing some volunteer work. They'll purposely make if it's an orphanage, they'll purposely make their kids look like they're suffering, or they'll not use the money for the purpose of what the organization is for.
Mhm.
And then it's just so that more Westerners can come in, that there's that constant demand. And so we really have to think about like how are we contributing to the system, not just like this A to B, you as a person going to this orphanage, let's say. It's how are we contributing in the system as a whole? Like, are you making it worse or are you trying to go against the grain? I don't know. You will tell us how to help. How do you think we can help, Diana?
Well, first of all, you recommended this great book, which I think just plugging that. Also not sponsored.
None of this is sponsored.
None of this is sponsored. But really just educating yourselves and educating others is the biggest thing that you can do. Like if you see someone that's doing like, what was it that some fitness model or something Susanna
Yeah.
up, and I went over there and I commented like this long thing, and a bunch of people actually responded being like, thank you for bringing this up. I saw this and I wasn't happy with what she said. And a lot of people commented back on my comment just saying like that they had wished that they could have figured out a way to say something. So just being someone that's vocal and actually saying it is already a
Mhm.
big way to help.
Yeah, I think, I mean, yeah, I totally agree with you, just educating yourself, but like where to start? I mean, it's gonna sound boring, but like read. Read a lot. I mean, it's very important. And also just talk to people and like I'm always willing to talk about this. I mean, it's like what I do. It's my field. I would say another very practical way to think about this is understanding the history of how this concept of global health even came about. And then also thinking about, okay, where am I within this position in the present day? So what I mean by that, and I did a highlight, it's in my highlights, and Dan, I don't know if you saw this too, but like a while back, I just did like a brief history of how global health even came about. And honestly, it was because Europeans, when they were doing their expeditions overseas to find like new worlds, they came across a lot of native lands, right? And for example, when they came to the United States or when they landed in like Africa and everything, they were colonizing, and a lot of the science came out from trying to benefit the military or the missionaries' health because they were getting sick from all these um, like tropical diseases that they weren't previously exposed to. For example, malaria. And so all these like new medical advancements started to come up, and some people will say that because there was so much medical like new advancements that happened because of colonization, that's a justification for it. Um, I mean, that's a discourse that we can maybe have in a podcast episode or something. But understanding the history of how it even came about, and then now within the context, we're starting to see, okay, it's not just about like richer countries going to these poorer countries trying to give them health. It's actually like a very intertwined system that goes back and forth. And um, global health, another misconception is people think it's always overseas. But I'm like, no, the United States or wherever you're at is very much part of the system. So like whatever is happening locally is going to impact globally as well. What U.S. policy would be helpful for global health?
Uh,
Climate change related stuff, but definitely.
what U.S. policy? Reinstating the use of the words evidence-based and science-based. There's that.
Oh yeah, that I think that would just help, like not just global health, science in general.
Being part of the Paris Agreement. Feel like this is a little bit of politically driven. This could get really derailed really fast if I
Yeah,
go way into this.
I mean I agree with that. I would say another one is a hot topic is like I don't know, thinking about how we approach asylum seekers from South, right? From Latin
Yeah.
America, Latin American countries or Mexico. Like how are we even approaching them? Like what what systems do we have in place to make sure that kids aren't just sleeping on the floor?
Yeah. It's also the systems in general currently. I have a few friends that work at law firms that do a lot of pro bono work for doing the asylum seeking process. And one person told me that only two out of all the ones she applied for this year were accepted. So it's not great statistics going on there. Um, yeah. So yeah.
Sorry, I'm here.
Um, that's okay. What? Oh my gosh. I think okay. Let me see. Sorry for the awkward pause. There's like a lot of great things that are happening, but we don't want to like go on forever. So a lot of these topics will be going into future live sessions that we are doing and the podcast that we are going to be putting out at the end of this year.
Yeah.
because we are both students that do 5,012 things. So, and as earlier mentioned, we are not even remotely near each other because she's in Oregon and I'm in New York. So
Yeah.
it takes a little bit of effort to record. Yeah.
Yeah. So,
What are your thoughts on veganism on
veganism.
um I don't want to go like way too into it, but there's this podcast called Science Versus, and they actually do a great little analysis of veganism, and it actually does make quite a decent impact on, not necessarily in terms of like global health level, but more so in terms of climate change and actual environmental impact for the like greenhouse gases and everything that are produced and the amount of water used, because production of animals requires a lot of water for feed and hydration. But I'm also not about to tell you to change your diet. That's a personal choice. So
Yeah, I haven't looked very much into veganism. I think that would probably fall more into the environmental and occupational health
yeah,
realm of things.
yeah.
Um,
So
I don't know. Are there more questions that people have?
um, I know that I got a few questions about the overpopulation, which I think deserves an entire episode onto itself. So I'm not sure if one can add a link.
Harm of volunteerism. Cool. Thanks for providing
Wow.
that,
Yeah.
Daniel.
Okay.
Yeah, so you got questions about overpopulation. I got questions on like just what can regular people do to contribute to global health, which I think we kind of touched on. But if you feel like we didn't answer that well enough, feel free to prod us.
Yeah. You can flutter inboxes. So that's fine.
Yeah.
Yeah.
But yeah, as Diana mentioned, we have this podcast that we're planning to launch in the winter. It's going to be
Yes.
called Global Caveat, right?
Yep.
And the general, okay, so when we talked about this, I'm super excited for it. So when we talked about it, we realized, look, it's such an interdisciplinary field that we think it would be great if the podcast, we'll talk about a lot of different things. All these questions that you guys are asking is really, it's all global health related. We could pretty much turn anything into global health. But it requires a lot of different expertises, like I'm not an anthropologist by training.
Yeah.
And I'm not like a climate change scientist by training, but having those perspectives really add on to the discussion of global health. So we foresee, contributors, just us having a discussion on like their work maybe and their field and how that put it into a global health context and see like, again, what can people do to make this planet a better place, a healthier place for people.
So like if anyone is interested, we'd be happy to do some interviews in the podcast as well. If anyone is willing to be recorded. If you're on the East Coast of New York, I will travel to you. So there's that.
If you're on the West Coast, I'll travel to you, but Diana has all the equipment.
Yeah. And should people
try to learn other cultures before they visit overseas?
100%.
Yes.
So I'm just going to give an example. I have done a lot of my work so far has been in Italy, working directly with the refugee crisis there. And before I went there, I had been working on and off in Italy for maybe a year beforehand, and I kind of got myself familiar with everything. So I know a little bit of like functional Italian, functional French, so that way I can speak to any like that community that I needed to. Not that I needed to, because they all speak perfect English. Like they like all the like migrants that I have met can speak like 5 languages, and I'm just like over here barely speaking English well. But I made sure to like understand where they were coming from, did a lot of ground research, talked to people that have worked there and done work there. I still talk to some people that are there working. A lot of them happen to be from Senegal. So like I have like connections there where I had people that work directly in Senegal and like know Senegalese to go do that more because I'm not qualified to do that. But I definitely wanted to make sure I understood the background of where everyone was coming from before even trying to address them because it's honestly just respectful to understand where someone else is coming from because I mean it's the same thing like if you were anywhere here and someone comes up to you and starts saying all these weird things to you based on them not knowing you, like it'd be weird, right? So like kind of the same. Pretty much just put yourself in anyone else's shoes and that's how you should go about it.
Yeah, I totally agree. And to add on to that, I would also say like it's great if you are making the steps to learn about the culture before you go, but also realize that you're gonna learn. I feel like that's 10%, and then the 90% will come when you're actually there.
Yeah.
Um, and also realize that if you're interacting with a group of people there, don't expect them to be representing the whole country. It's just a very small part of what you're experiencing. For example, like if someone who isn't from the United States came and visited me in Oregon, the culture in Oregon is very different from where I grew up in, which is Colorado. So they could have a general idea of what North America is like, but if they wanted to know like, the vibe in New York is just so much more different from the vibe in Oregon.
Yeah.
Completely different.
Yeah.
So keeping like those differences in mind and going to these countries and just realizing you're an outsider 100% of the time. Even if they tell you, "Oh, you're like one of us," you're still an outsider.
Yeah.
100, yeah.
How do researchers measure? So, okay, this has a lot to do with policy and it's pretty
Mm-hmm.
complicated because so the way that you go about even making policy change, you typically have to write a policy brief and send it to the minister of whichever specific thing you're looking to make a change in. So, like, if you want to make an effect in mental health policy, you'd write it specific to the minister of mental health at that specific location. And you would have to write all of the different things, like try to do studies on how much someone is losing income or like workforce due to the problem and then compare it to what they could be making if they addressed the problem and then pitch it in a way where you get the local government to fund it and then like initially the local government has to be the primary funding and or the main source and then there's like the
Mm-hmm.
additional that will come match. It's very complicated.
Yeah.
The funding process of everything is like super intense and a lot of times people that come into this field are coming from MBAs and business degrees because it's just like policy is complex.
Mm-hmm. Yeah,
Like
and at a
even
global
yeah,
level, I mean, we have there's a concept called global governance
yeah,
for global health, and it's super confusing because it's like when you think governance, you think like a government or some kind of authority figure, which in the global context we don't really have. There are like institutions that set the agenda for like, oh, here are the health issues that we should focus on. And those are like the World Health Organization,
yeah,
right? We have the World Bank, which pretty much provides a lot of financial assistance. And then we have foundations like the Bill and Melinda Gates Foundation, which they fund like almost anything and everything imaginable out there for global health efforts.
yeah. And there's a
So,
lot of small things. It's not just like these massive organizations. Like there's
yeah.
small challenges. Like Canada does a challenge series. It's like the Grand Case challenges, and they fund small projects. And there's like a lot of small things that go around for
Hmm.
like 10,000 USD or 10,000 Canadian dollars or whatever currency, and then like you can find other sources to match it. And NIH does a lot of things. So it's
Yeah.
like out there. It's just you have to do a lot of grant writing and paperwork to get
Yeah.
a little bit of funding. So yeah, maybe put that down
Um,
for a whole episode.
yeah, I mean, policy change and governance is
Yeah.
honestly like a big topic. So we could definitely put that
Yeah.
as an episode. How can us regular folk help influence policy change? Oh, good question, Naomi.
Yeah. Um,
I
Voting, first of
Yeah,
all.
I was gonna say voting. In the United States, voting is elections are coming up November 6th. So if your state still has time to register, you should do that. It's a privilege to be
Yeah.
able to vote.
You can also still register to be an absentee voter. I think if you register this week, it's still good because you have 14 days before usually to register. Just
Mhm.
side note. Yeah.
Yeah, I would say don't if like you're not in a healthcare related field, that doesn't mean you can't contribute to influence policy change for health issues. Things like voting for candidates that just want to be have more inclusive policies in general that like health is very integrated into, people's economies, um, like what they eat, right? Education is directly linked to health, and that's super important. Like, what educational policies are candidates putting forward, and how do you want to support it?
Um,
Door.
Wait, also, just in general, to continue going off Naomi's thing, if you just talk about it, because a lot of times, like
Mm-hmm.
earlier, I mentioned that I commented on something, and then like a bunch of people commented after, being like, "Thanks for saying something." Like just mentioning it makes people think about it, and that already has a ripple effect in itself.
Yeah.
Yeah. Uh,
Implementing
oh,
program plans. Communities. I'm not sure I understand this question to the
um,
effect of what you are asking. So, do you mean by implementing program plans as in like the actual implementation process or providing a plan for the community? Because those are two different things.
um,
I don't know how
to
you're understanding it,
educate
Diana.
in global health to advance education. Um, so global health is not necessary. It's like, okay, um, global health as an overall is not typically the topic that you go in trying to make a change in. It's usually like individual things. So there'll be a plan that's like, here is something to address HIV, AIDS acceptance in this community so that they can know about it. And then that helps increase the just health of people, like mentally, physically, and everything, because then people understand that disease. Or you go someplace and then you're like, oh, here is how to have better hand washing and sanitation. So it's like small things. It's not necessarily like you don't go in being like, here's this massive concept that we're going to drop on you now. It's like really small things that you do individually into like different communities that need that specific thing.
Yeah, so an example I can give from my own work is probably um, I did like this very brief workshop with mothers in Fiji on sanitation. And it was very simple. It was just, we had like this poster with these graphics, and it was just like, when should you wash your hands? Like for their kids, right? And it's like after they come from playing outside or after they come home from school. And like, should you wash your vegetables? Yes, like you should wash it. Simple things like that. And put it in their own languages is very important. Obviously, not
Yes.
everyone speaks English. Um, and a lot of visuals, pamphlets. I mean, people love pamphlets, at least in my experience. They'll take any and every pamphlet that you bring with you. Um, and just providing those and then having some kind of like interactive discussion to just talk about like, okay, like what's your experience like? And then like, oh, here are some educational things that you may want to consider. And that's just a very basic thing that I've done, that I've seen people enjoy and hopefully worked.
Yeah.
Yeah.
Okay. So I think we've been talking for a while, so I think we're
Hmm.
going to end this. So,
Yes.
but we are going to definitely be doing this more frequently, and we will have the podcast coming out in winter. So you guys can
And
be on the lookout for that. And we'll be doing more of these lives. So you can always send us questions and we'll either answer them directly or we'll like compile questions that make sense together and then have like themed sessions.
Yeah. So, I mean, so far, even in this session, we've had a lot of topics come up, like
Yeah.
a lot of policy stuff, volunteerism, all those things. So we could definitely talk about all those things. If you would like to hear more, please send us whatever topics, questions. And then if you foresee yourself possibly contributing somehow, we would love that as well.
Yeah.
Yeah.
So, yeah. Thanks for joining us,
Okay.
everyone. Yeah.
Thanks, everyone.
Okay.
Bye.